This is Optometrists Building Empires, and I'm your host, Ankit Patel. Each week, we'll explore the journey of multi-practice ownership and leadership in optometry. Join us for insights and strategies from the top minds in our field. This show is sponsored by My Business Care Team. My Business Care Team helps your office increase revenues, reduce costs, and reduce staffing headaches. Let's build your empire together. So today's guest is someone exciting and really unique background. She's a dedicated public servant, optometrist, military officer, as well as a playwright and producer. She serves as Lieutenant Colonel in the Oregon National Guard and serves as a representative for House District 45 in Oregon Legislature and represents Northeast and Southeast Portland. As I mentioned, she's a playwright and producer, and her play, Belonging, a memoir, premieres June 21st, 2025 at the Winning Stad Theater in Portland. In addition to that, she's also spent nearly 3 decades providing quality eye care to her community and as the owner and optometrist at Rose City Vision Care, which has 2 locations in the Portland, Oregon area. Please welcome Dr. Thuy Tran. Dr. Tran, welcome.
I'm glad to be here.
Yeah, you have a very unique background, and so I'm really curious. I'm excited to have this conversation with you. So, kicking us off, what was the most important thing that's helped you build your life and your empire? You have a very full life. So what's the most important thing that's helped you kind of grow that?
That is a good question. I wanted to be in private practice when I graduated from Pacific University in 1994. So I worked part-time at an ophthalmology clinic and then opened my office cold with the help of family. My mom and dad sold their home, moved from California to Oregon, and I took some of their money, and my uncle took out a home loan to support me at that time. And I was just hoping to have 1 or 2 patients a day while working part-time at the ophthalmology clinic. But from there, the practice grew, and one door opened after another, and here I am.
So as you had all these opportunities come in front of you, what was it that really? How did you make your decisions? What was your North Star? Like, how'd you know that, hey, this was the direction you wanted to go versus not? Kind of help me talk through that, because like I said, military, you had your practices, you have you're a playwright and producer as well. How do you make your decisions when it comes to that?
Well, when you are exposed to an idea, and if it resonates with you, and if it fits the timeline or the structure that you have for yourself, right? Because what is the timeline and structure for an optometrist? We want to do better in our profession. We want to build our business if we're a business owner. And so I just progress along that journey. And when a door open, you just walk through it. For example, I started out with one clinic, and after a while, I said, "Okay, I did well. I established a community here. Let's expand so that other folks can receive the same professional, loving care that Rose City Vision Care provides." And then you just build another community. So I opened my practice in 1995, and then I strive to open my second office in 2005 in the adjacent city, Beaverton, and I strive to build that. But at that time, I was building it with regards to how great Dr. Tran is with patient care. And it was just a little bit too much for me, especially since I had 3 kids and I was married at that time. And so something was not right with the processes, right, of having 2 offices. So I went through a contraction period where I had to let go of one. That was devastating because you define yourself as a business owner and optometrist, and here you go. not succeeding at building the second practice. So you seek out you try to find out what you did wrong, right? And so I went back to school and got my MBA, thinking, okay, that's going to solve the problem, and made the next period of expansion of my optometry empire easier. So I went back to school. I went back in 2013 to 2014. It was a 2-year program. And in 2015, I bought my second practice. And I was just driving by a part of town on my way to pick up my kids after school. And I said, oh, I've never visited that practice and said hello to that doctor before. So there was a phone number, and I picked up the phone and called him. And he answered. We had a wonderful conversation, and then he was about to retire. And I said, okay, let's make a deal. And then I built up that practice since 2015. And so that's going on 10 years. And my first practice is going on 30. And when you build a community, you love them as if it's of your family, right? So when a Lions Club member knock on my door and chit chat with the business owner so that they can invite me to a luncheon, I went and learned, and I was impressed by these Lions Club members living by the motto, "We serve." That motto resonated with me, right? And so I became a member. Here I go, developing a family in this group of folks that believe in this motto, "We serve." And then another door opens, and I learned about being a military member in the Oregon Air National Guard, right? And there I developed another family. And what was so neat with the Oregon Air National Guard was I belonged to the 142nd Medical Group. And so I was chief optometrist there. So it's still Army optometry related, but now it's a different kind of optometry. And I was able to go on military, medical, humanitarian missions to places like Vietnam, Bangladesh, Sri Lanka, uh, and even some that are in the U.S., such as Kodiak, Alaska, and Atuvik Pass, Alaska, Mississippi, Missouri, Arkansas, where the needs here in the U.S. was just as great as abroad. And I met, amazing military optometry folks.
And I love how you told your story there. And, I think so many times we hear the story of, oh, everything was just perfect. I did this, then I had this success, this success. I really appreciate the fact that you're like, no, it wasn't easy. I tried the second practice and it was tough, and I tried to get it back into it.
And you get to accept the fact that the economy changed, right? People's spending habit change, technology changes, and expansion and contraction of your practice changes, even due to workforce, right? Your associate doctor changes, rotates in and out of your practice. Your main optician, your manager changes. And so you just go with the roll of the dice.
I heard a theme across your stories, a theme of community and family. I think you used the word family a couple of times in different contexts. How does that impact the way you make decisions for your practices? Can you give me an example of a time that you made a decision because family or community was important to you, others may not have made? It may have been something related to finances, may have been related to bringing something into the office, maybe related to, hey, let me take a different position in my community. Help me understand how that informs your decision making.
As my patient base grow older, I needed technology, right, to help me care for them. So of course, I had to move to acquire like an OCT or a corneal topographer, an oculus, and things like that to support them. Because the ups and downs of my community members, through the Hollywood Lions Club, um, um, use my office as a local eye care clinic for the needy. So I broke down the eye exams, and my Lions Club member volunteered to do each station. Of course, I'm still responsible for the end product, the care, but that's how I supported the community, right? When there was issues in the community, which are mostly my patients, right? Having been around for so long, many folks in the neighborhoods are my patient. When 10 school days was being cut, right? From the school year, guess what? Dr. Tran went to the local school board, school district board meeting and say, don't do that. And so they saw me, and then they invited me to be on the school district board. And so you get engaged and you dig deep into creating a thriving community. You help your family members. And I think that is how you build an empire with really strong foundation and roots. Um, right now, I get to be state representative of my house district. So my patients come to me during their eye exam and share with me their issues and concerns. And if I can help them, I can, right? And it's that connection that you build with the patient, and it keeps me very busy. But that doesn't mean that the practice is going to grow, because if I build it upon how great Dr. Tran is and how wonderful her care is to the patients, they'll want to come and see me, and there's no duplication of myself. And constantly, I am striving to build a practice where patient would want to come back for my associate doctor, for my optician, for how wonderful my manager takes care of them, and of course, the wonderful products and services too.
Yeah. And I love how, it's interesting. Almost everyone that I've talked to has some sort of their own take on patient care. You really take it to another level with I'll call it community care. It's how do you really take care of the community? It's really interesting to hear how embedded. I think that motto you said earlier, here, service, family, um, that really just comes across in who you are and what you do in the community every day.
Yep.
Even so, I'm gonna ask this just because it is a business podcast too. How has it affected the business being such a key member of the community? Have you seen it increase business? I know that did the second practice the first time, you contracted back down to one. How has it changed now that you're more of an embedded part of the community? Has that made a difference in your business the second time around with expanded to two?
Yes, as you get involved with your community, it's like pro bono advertisement, right? Free advertisement, and people know you and trust you, and then you come. And I encourage my staff members to do that also, get engaged with their churches and their schools, so that there's that personal connection, and it's not transactional only. Um, and people don't care about you until they know that you care also. And there's many different level of caring. It's a way I build my practice. Might not be a multi-million dollar practice, but it is very rewarding. And it allows me to have communication, conversation, and connection with my neighbors.
Yeah. You hinted at it a little bit. What were some of the challenges that you ran into when you grew to two locations, the first time and the second time? I think you said earlier it was like you were the business, and so that was a challenge. What other things did you run into?
Processes, you got to duplicate the process so that the staff can move between the offices and have uh, continuity. Um, I set up the second practice with the intention of building and then selling it. So I separate the system, right? Separated the database, separated the tax ID number and all of that. And that was challenging to juggle too. So when I let go of the second practice and then start the current two one, I strive to streamline the processes, and I strive to make it so that the staff can flow back and forth between the two locations seamlessly, same technology, same processes, so that they can support each other. And of course, as I go on my adventure, right? If I have supporting staff, they step up, wonderful. But if not, I tighten my belt and be more conservative in my spending and purchasing. Because I came over to the United States in 1975 as a refugee of the Vietnam War, I am very conscious of the marginalized, I would say, uh, community of immigrants and refugees. So one of my clinic is in an area that is very diverse, not just in ethnicity, but also in income. And so, how do you create an environment where you serve a lot of people? The price range is um, it's accessible to everybody, from people wanting fancy, frame, to those with very, ec- um, what is it, economically conscious purchasing power, purchasing style. And so that's it's a juggle all the time. Like, should you buy this? Should you buy that? How should your frame boards be? Um, And then as I move away from the office, for example, currently I am in session right now at the Oregon State Hospital. So I'm down here. So my clinic hours are cut, right? When I had an associate doc, then she would step up and see me. But my personal income as a clinician from that is decrease. And so I have to make it up with by encouraging sales and other promotion to balance it out.
Hmm, interesting. Yeah, I think everyone can empathize with that for sure, especially when you're not there. And I do want to, and we'll circle back to it because you are in a unique position to talk about scope of practice and things that you might be seeing coming out of the pipeline. We'll come back to that conversation a little bit. But as far as your challenges, you talked about a handful of them so far. Are you seeing challenges with staffing as well, like getting enough people or keeping the right people? Is that something you're having challenges with? And if so, how are you kind of working through that?
Yes, staffing is always a challenge. Uh, you can always hire folks that are well trained and pay them well so that they can stay with you. However, sometimes when the marketplace is tight for staffing, then you get to train them up from ground zero. So how a person during the interview uh, talk about other people, treat other people. They have to have that heart that is needed in patient care. And then the technical skills, I can train them up. Yeah. For docs, they come fully trained, of course, because they need to be very independent. But there is a protocol that my manager go through with the help of Vision Source to train up my staff. And then I make sure that they are not just in one lane. So if it's the optometric technician, she needs to know how to do front desk issue as well as being dispensing optician sometime, as well as supporting the manager with billing also. So that cross training is really supportive in when time or hard when time or hard for hiring.
Does your staff also have the community focus like you two? I'm just curious. Do you do anything for them to support, hey, participating in the community, participating in Lions Club, anything out there?
It all depends upon the person, right?
Okay.
Some may be involved with their schools more, with their children's activity, with their churches. So you support them when they can, but I don't think any of them will match my speed.
Yeah, yeah, it's hard to replace the owner, right?
But I enjoy what I do. And so as I build my optometric empire, it may look different than other folks, but I go towards where the values resonate with me, where um, it brings me joy. And that is so very important because any business, there's going to be high time and there's going to be low times. And if you are passionate about it, if you are in service, if you live by your values, and if you get to go on your adventures, yeah, yeah. And optometry has provided me with very well lived life.
That's great. But what would you say some of your yeah, can you touch on your values a little bit? We talked about that a little bit, but what would you say your values are? And do you share that with your team? And like, talk to me about your values a little bit more.
Um, well, for example, I mentioned previously the Lions Club is we serve, right? So servant leadership. I share that with all my staff because I believe in 360 leadership. You lead up, you lead sideways, you lead down. Um, I am in the military, Air Force in particular, and the Air Force core value is integrity first, um, excellent in all we do, and service before self. And so those kind of beliefs, I am sure I translate that over to my staff. Um, so, and my belief is that my staff members are my frontline folks. They're closest to the action, they're closest to the problem, so they are also closest to the solution. So uh, I trust but verify. Accountability is very important to me. And I hope that translates into how they interact with each other as well as with the patients.
Okay. And as far as your biggest challenges, like what are something like right now that keeps you up at night? You're like, ah, man, I wish I had this problem fixed. I'm just curious, so people kind of get a feeling for, okay, what are some of the big challenges you face?
Um, is to again, staffing is the current problem right now, but I am moving towards my 60 year of age, so I am thinking about an exit plan right now. So my when I'm not busy and my mind drifts to worrying, I think about my retirement. Do I have enough investment in my retirement income? Do I have a bunch of properties? Am I going to start letting them go? And then how will I take care of my children who are now grown? So I got to let them fend for themselves, but you still want to leave them with something. My parents are growing old, and so
Yeah.
how will I take care of them? And I was a single mom and still am a single mom for the longest time. So my worry is how will I care for myself when I get older too? So as you're building your business, you get to think about the now, the fun times that you want to have, and then later on when you are not in the growth phase anymore, but the more of the exiting phase.
So, I think a lot of folks have you considered private equity, other doctors? You care a lot about the community. How do you think about the next person that's going to take over your practices? What do you look for in that potential person? Obviously, it's not anytime soon. And so we want to make sure, but like, have you given any thought about that? Or just curious? If you haven't, that's okay.
Well, I wanted to have a private practice. I want to have control basically on my patient care. I hope I will find an associate doc that will have the same drive to be in private practice, to be in community, to serve. Um, at this time, I do not want to have the third or fourth office because I am my plate is quite full, and as you mentioned, I am exploring my creative self with my current adventure on producing a play. Um, this year, the play is coming out, and it is very significant because it's the 50th year anniversary of the fall of Saigon. So when Saigon fell, so did a democracy. And that is significant because as a state representative, I create policy. So, how can I create policy to strengthen um, my community? And it could be my optometry community too. We have a bill right now that is asking for tax incentive for rural optometrists, right? To incentivize them to go into rural Oregon and provide for the community there. Um, I am what else? And I'm last term, last session, um, we strive to work to expand scope of practice for optometrists here in Oregon. And I'm not doing it for myself. So the Oregon Optometric Physician Association gets to work with me so that we can protect our scope or expand our scope of practice and um, provide good quality eye care here in Oregon. So there are things that you can do, but it's collaboration. And so as soon as the Oregon Optometric Physician Association say, "Hey, Rep Tran, this is what we want to fight for," then I am building the community in at the Oregon State Capitol so that when that ask comes, I am ready.
Yeah, that's fantastic. And you kind of touched on the next question I had is what are you looking forward to? What are you excited about with your business, with industry, or even with your career, right? I mean, if I was in the area, I'd come to your play. If I ended up being there, I'll definitely come check it out. But what are you personally excited about anything that we talked about?
No, well, every day is a new day, right? It's a chance to learn and it's a chance to grow. I strive to live in the moment and not, um, I don't know. I'm going to build and I'm going to create a strong foundation with what currently that I have. However, it's the unknown that is just so exciting. So whenever I'm put into an environment at this time, I'm gonna bring it to it my best, learn, and then always be open to opportunities.
Love it. And shifting gears a little bit, you probably have a very rich stories that you can pull from when I ask this question. Um, I like to ask if you can share with me a couple of formative moments in your life that made you who you are. If you're very heavy into service, you care about community and people. Is there a story in your life that relates to that, or just any story that resonates with you the most that you feel like, yeah, that experience made me who I am today?
One story in particular was when I was on the Park Row School District Board. Okay. And then, if you know anything about politics, when it gets up to the date of the vote, the decision has already been made, right? People know how they're going to vote already. So you have to get at them before they make their decision to change anybody's mind. Um, the school district wanted to outsource busing. All right. And these bus drivers are my patients too, right? So are the students, so are their families. Uh, it was the outsourcing was because the superintendent didn't want to be in the transportation business. All right. And so she wanted to outsource it. But when you outsource it, those local jobs may not be there anymore. Right. And the bus drivers from the community, from the community care for the kids so much. So that it's not like somebody from outside coming in every day and driving them. They know the kids. They care for the kids. And so I was the dissenting vote that killed the decision. But when I killed that decision, I saved jobs. And so that was when I realized that uh, optometry, being an optometric physician, being a small business owner, being a mom, led me to a place where, with a vote, yes or no, I can affect many lives, right? Because as an optometrist, you sit in the exam room, and yes, you take care of the person, but you can do so much more. So build upon into your skill set as you care for your patient, and use that skill set to serve in other ways of your life. And so that moment when I realized, oh, look at what I can do with just one word. All right. That opened up a whole new world for me. And just think, if I can advocate in the Oregon State Capitol for optometrists to get tax credit, like pharmacists and like MDs and dentists as such, I can help so many. And in turn, it will affect their patients and it will affect their communities. So as optometrists building their empire, that's your theme, right? Don't underestimate what you can do. So looking forward, I don't know what I'm going to be able to do, right? I see people with the ability to make so much more impact. So let's ask, how can we as optometrists, building our empire, creating community, serving, leading, be impactful to humanity as a whole? So today, just right this afternoon, there was a bill that restrict usage of experimentation on cats and dogs such that they reach a certain level of pain. Right? So no public funds um, to fund experiment in whatever facility that induce pain to animal. As optometrists, we don't want our patient to be in pain, right? But how many sentient beings out there are in pain? And I just mentioned cats and dogs. But can we support our community to end homelessness, to end drug addiction? Can we get them better health care? So I'm fighting for a bill that does continuous glucose monitor. So in Oregon, if you're on Medicaid, you have to fail 2 medication before they allow you to get a continuous glucose monitor. That's too far along. As optometrists, we want to do preventative care. We want to talk about lifestyle, healthy eating, exercise, so that they don't end up with diabetic retinopathy and macular edema, which will lead to vision loss.
Yeah.
Right? But we don't realize that our expertise as we build our practice is so useful in preventing so many people from going down that pathway from, just pre-diabetic to full-blown type 1 diabetes with retinopathy and macular edema. So,
Yeah.
yeah.
I appreciate you sharing that. That's actually a pretty cool story.
Yeah, pretty cool, right? But you fight against bureaucracy who do not want to spend the money or give the authority. Here we're talking about the Oregon Health Authority to allow their physician to prescribe continuous glucose monitor effectively in the preventative phase.
Yeah. And I'm curious, just as you were talking, I was thinking, yeah, you got into politics and were able to make influence change that benefits your community. If other optometrists are curious about it, like, talk to us about your story and your path and how you got involved with the state legislator.
It starts with just somebody asking me, "Hey, Thuy, have you ever considered?" And I said, "Oh, what is a state representative?" I didn't even know what they do. Set policy. What kind of policy? What do I have to do? You will never know what you're going to do exactly by having somebody tells you, this is what it does. So I would just recommend follow your passion. If you're passionate about the environment, if you're passionate about education, if you're passionate about elderly situation, if you're passionate about law, if you're passionate about whatever, just go and dig deep into it, and more doors will open for you.
I
And
like it.
because when you follow your passion, you're excited, right? You're eager to wake up early in the morning and build your practice, taking care of your patient, taking care of your staff or the community. That forever learner in you will keep life exciting.
What knowing what you know now, what advice would you give to yourself about a week after you graduated OD school?
Well, when I graduated from optometry school, I was worried about the future. Right? Where am I going to get? Yeah, how am I going to find my first job? Am I going to open my practice? Oh my gosh, my student loans. Uh, I have to start paying them back, and I can't take out anymore. So there was a lot of worry, and now of course, those worries are still there. I'm not so carefree that I don't have any worry, but I'm in the moment more and I enjoy even our conversation here. You can hear my energy. Oh my God, this is exciting. All the stuff that I do. And uh, Currently, I am learning about how to use social media to enhance my profile as a state representative. And of course, that's going to carry over on how I will use social media to enhance my practice, right? And
Yeah.
it's all interconnected. We are all interconnected, and it's just a lovely way to live. So I would look back and I say, Thuy, don't worry so much. Just go one after another, those interviews, and you'll find a place. And from there, other opportunities will open and you will be taken care of.
I love it. So, Dr. Tran, if folks want to reach out to you, learn more about you, ask you questions, where can they find you?
RoseCityVisionCare.com. That's my website. You can contact me there, or you can contact me at rep.thuytran at oregonlegislature.gov.
Rep.Thuy at oregonlegislator.com.
.gov.
.gov.
Yes, yes. Or you can look at tranfororegon.com. That's my campaign website. Tran, my last name, FOR, then Oregon.com.
I was going to ask, is it like the number 4 or the word for is
FOR.
FR? And we'll put those in the show notes as well for folks who want it. And so again, Dr. Tran, thank you so much for being on this show.
Thank you for having me.
And thank you, audience, for listening. And if you love the show, learned anything, please share the video or the podcast with your friends and subscribe. Thank you again, Dr. Tran. This has been another exciting episode of Optometrists Building Empires. We'll see you next time. That's a wrap on another episode of Optometrists Building Empires. Thanks for joining. For show notes and more, visit buildingempires.live. This show is proudly sponsored by My Business Care Team. My Business Care Team was born out of staffing challenges my wife and I faced together, managing multiple optometry locations. We refined our approach at Classic Vision Care and now offer our expertise to others. If you're experiencing challenges with staffing and you'd like to set up a discovery call, we'd be happy to help you and connect you with the right resources. We'll see you next time.